Good afternoon, everyone. I want to thank you so much for being here.
Thank you, Dr. Weary. Hi. Hello, everyone. I'm glad to have you with us this afternoon. This is Lori Samatenka, and I'm the Executive Director of the National Consumer Voice for Quality Long-Term Care. One of the biggest challenges since COVID has hit the world actually has been the restrictions on visitation and the separation of residents from their families, which has been happening for more than 6 months now. We know that's been exceptionally difficult for both the residents and their families, and many people have been very worried about their loved ones' health and safety during this crisis and when they're going to be able to get back together and what that reunion is going to be like when they are able to reconnect. So today we are partnering with the Maine State Long-Term Care Ombudsman Program, where we're going to have a presentation and a discussion to talk about the principles and interventions of moving forward while supporting ourselves and our families. We'll be talking about visitation in long-term care facilities and the challenges that may be present as you reconnect with your loved ones. And we're also going to talk about the ways in which you can prepare for your reunion with your loved one, as well as to learn ways that you and your family can build resilience for the coming months. Leading the discussion today is Dr. Susan Weary. Dr. Weary is a nationally recognized keynote speaker and workshop facilitator on depression, dementia, and healthy aging. Her presentations combine over 30 years of experience with wisdom, compassion, and common sense to engage attendees, help build skills, and use proven techniques. A few of her work highlights include helping the Centers for Medicare and Medicaid Services develop national programming on mental health and individualized care planning in nursing homes, authoring OASIS, which is an interdisciplinary, person-centered curriculum that has helped transform dementia care, support mental health recovery, and reduce inappropriate antipsychotic use, and partnering with CMS in the National Initiative to Improve Dementia Care. Dr. Weary served as Commissioner of the Department of Disabilities, Aging, and Independent Living in Vermont, and she represented Vermont at the 2015 White House Conference on Aging. Since 2017, she has been the Chief of Geriatrics at the University of New England College of Osteopathic Medicine. Before we hear from Dr. Weary, I'd like to just turn it over to Brenda Gallant, the Maine State Long-Term Care Ombudsman, to say a few words of welcome. Brenda?
So thank you, Lori. We are very pleased to be a co-sponsor of this webinar, and we want to thank all of you for joining us for what we know is a very important conversation. And every day, the Maine Long-Term Care Ombudsman Program hears from residents in long-term care facilities and their family members about the profound impact of being separated from each other as a result of the restrictions in visitation due to COVID-19. And we know that the experiences of our residents and families in Maine is not unique, and that residents and their family members across the country are faced with the same extraordinary challenges. Like all of you, we look forward to the reopening of facilities and the reunification of families. And we're very pleased that Dr. Weary has agreed to do this presentation. She's been a tremendous resource to me in my work as an advocate over the years. Most recently, she's worked with us in supporting residents and families in dealing with this unprecedented pandemic. And so we're just so pleased that she's here with us today. And again, we're so glad and honored to be part of this presentation.
Thank you, Brenda. Glad to be partnering with you on this and looking forward to today's presentation. Just want a few housekeeping details for the participants. One is that today's webinar is being recorded. The recording and the slides will be emailed out to participants in the coming days and will also be posted on the Consumer Voice website at www.theconsumervoice.org. We'll also in just a minute be posting a link to the slides in the chat box where you can download them and follow along during the presentation. All lines will be muted throughout the webinar. Please post your questions for Dr. Weary in the Q&A box on your control panel, and you can use the chat to make comments or discuss some points among yourselves. With that, I'm going to turn it over to Dr. Susan Weary. Thanks, Dr. Weary, for being with us today.
Thanks, Lori. It's certainly my pleasure and privilege to be with you, and I want to thank both Consumer Voice and the Maine Long-Term Care Ombudsman Program for hosting this conversation this afternoon. As both Lori and Brenda have said, this COVID-19 pandemic has knocked us all for a loop. It's impacted everyone, perhaps no one more than people living and working in long-term care, their families, and their friends. Our way forward out of this unprecedented disaster and our collective traumatic experience is going to require our continued resolve, our strength, our resilience, and our skill. My goal today is to try to bolster that, to enhance our knowledge a little bit, in hopes that you will take away some skills, some insight, some ability to, in fact, nurture your own resilience. I can't thank you enough for being here. I can't thank you enough for participating and for all you do for your families and friends, and if there are workers who work in long-term care, for taking care of people in long-term care. It is so good to be with you today. Here's the outline of what we're going to do. We're going to basically reflect very briefly on our shared experience to date, and then we're going to talk about how to move beyond and grow from that experience. We're going to talk about how to prepare for the next phase, because this isn't over. It will be, but it isn't yet. And so we need to prepare ourselves practically and psychologically for the ongoing COVID-19 experience, as well as for the next phase. We're going to do that by nurturing our resilience and by basically kind of sharing tips on how we do that. And I look forward to the discussion. And I should tell you, just by way of background, that my remarks today are built on my personal experience working in disaster recovery after Katrina in New Orleans for about 5 years, helping nursing homes regain their stability. It's also based on my knowledge about what constitutes trauma-informed care that we apply to this particular situation. And it builds on that area of trauma study that talks about how to grow from traumatic experiences, what you'll hear referred to sometimes as post-traumatic growth. So just know that that's the foundation, that what I have to offer you is strongly rooted in science, as well as in lived experience and in some common sense, as Lori nicely said in the beginning. We got to start by kind of feeling out who's here and seeing how we're doing. If we were live, we'd be able to look at each other, look around the room, and we would be able to see how we're doing. In creating a virtual community, though, it's important that we start with a check-in. And so I'd like you to please type in the box one word that describes how you're feeling right this minute. And Lori has agreed to read them off as they come in, and we'll see what themes are emerging and to kind of take the emotional pulse of our room, if you will, today. So Lori?
Yeah, they're coming in fast and furious. We're hearing tired, juggler, apprehensive, overwhelmed, frustrated, stressed, hopeful, disappointed, anxious, ominous, distraught, discouraged, uncertain. Lots of terms coming in, Dr. Weary. Anxious, screaming, busy, unsettled.
Thank you. And what I hear in all of that is not a surprise to me, because that is where we are right now. We're in this period of disillusionment in which anger, anxiety, apprehension, stress, discouragement, loss of hope, tired, fatigue, overwhelmed is kind of the order of the day. And we're going to do something about that today, and we're going to try to see if we can't figure out how to get a handle on it for ourselves and others. It's also important to underscore, though, that that's not the only feeling in the room. And while that's what many people are feeling, we also see some lights of hope, people feeling positively, people feeling less discouraged. And in our community here that we're creating this afternoon, we want to remember that for those days that we're feeling exhausted, like we just can't do this anymore, if we look around, we might find somebody who's a little less tired today, who can bolster us, and then they can rely on us tomorrow. The second notion about creating virtual community this afternoon is to just check in about your COVID experience. We have a brief poll here, and what I'd like you to answer in the poll is how long it has been since you have seen face-to-face your loved one. Less than a month, 1 to 3 months, 4 to 6 months, or greater than 6 months. And this, of course, is going to be influenced by a number of factors. How long the person that you love has been living in a long-term care facility, how long they have been in the lockdown situation, whether or not you have window visiting available to you. And I suspect we're going to have here a good range of experience. We'll leave the poll up for about a minute, and then we can see, we'll just leave it up there for a moment, kind of the range of experience that we have in the room. We'll wait till about 50% of people have voted. Oh, there's still a minute to catch your vote. There you go. We'll stop it there, Libby, and if we can just leave it up there for a moment. Most of us have been in this situation of not having been able to see our loved one for over 6 months. And let's just let that sink in for a moment. Another third of us, it's only been about a month or even less than a month, with fewer numbers in between. So we have the extremes represented here, and it is no surprise that we're feeling tired and discouraged given these poll results. Thank you very much, Libby, for helping me set that up. So we're gathered today to see if we can't change a little bit how we're feeling, how we're doing, and find our way forward. So, reflecting back for just a moment about our collective experience, we know what it's been like for 6 months. We know what it was like back in March and April when nursing homes, assisted living, other group living situations closed to all visitors, closed to ancillary staff. And as if that weren't enough, people were also quarantined in their rooms. So that not only did residents of long-term care not have the fellowship and friendship of their families, they also didn't have the fellowship and community of their communities in long-term care. This loss of communal experience has had a profound impact as well, whether it was not having a communal dining experience or not being able to go to activities. And with that, we also have a great deal in the beginning of uncertainty and a lot of shifting conditions and a lot of shifting advice. And our long-term care facilities did not have sufficient PPE. It's an extraordinarily difficult and stressful and challenging time. A lot of those interventions, like the quarantine, like having people stay in their rooms, had actually the desired effect. Many places, not all, many places were able to contain the virus if it came into the facility. A lot of places were able to mitigate the risk of having it come in quite successfully and have never had a COVID case. And other people have had outbreaks of COVID cases. So those interventions that were so incredibly challenging 6 months ago had the desired effect. And in the community had the desired effect. Anywhere where people were abiding the 5, and you probably still remember them: wash your hands, sneeze in your elbow, don't touch your face, stay home if you're sick, and keep 6 feet apart from other people. Don't go to choir practice, no singing, okay? And then wear a mask. And in those communities that abided the 5, wore the masks faithfully, we saw our levels of COVID rates go down. So this was a good thing. The problem is, of course, that you all know as well as I do, that the other part of our shared experience is that after 6 months, it may have had positive effect, but it's also had very negative, unintended consequences. Not unanticipated, but unintended. And there is now a great deal of distress and loneliness, deconditioning, weight loss, inability to do ADLs. that are impacting many, not all, residents of long-term care. So it's a very serious situation, and I'm glad we've gathered today to talk about it. Families and facilities have responded to this situation from 6 months ago to today with a great deal of compassion, with a great deal of creativity, whether it is from window visits, outdoor parades, learning how to use Zoom, getting iPads in, iPhones, smartphones, setting up telephone trees, whatever it's been. Facilities and families have stood up knowing that in the face of isolation, there was going to be problems. And we've done it with great determination, but also, as we're hearing in the beginning, it's getting old. We're feeling frustrated, sorrowful, but from the beginning, some days have been easier than others, and we've grown pretty tired of it. So what we know is that no one has been untouched by this, and we know also that disasters have a pattern. We also know that our ability to recover from this and from the collective trauma that this has been. People have missed milestones, be they births or deaths or birthdays. People have kids home from school that they're trying to figure out how to educate. And we know that recovering from this total disruption in our lives have some common elements. We know it's not over yet. We need to nurture our resilience, and we can do it. One picture I'd like you to kind of have in your mind about where we are is this from the Substance Abuse Mental Health Service Administration, also known as SAMHSA. This chart is taken from them. And this is kind of a course that a lot of disaster recovery and a lot of disasters follow. In the beginning, and you can think back to this, in the beginning, there is the sort of information kind of coming out January, February-ish. There's this outbreak of a SARS kind of virus in China. We're wondering if it's coming. People are sort of getting ready. There's this pre-disaster phase. And then it hits, and it hits hard. And in March, we go into this shutdown mode, right? But in the beginning, we enter, oddly enough, a kind of heroic phase where you, if you think back about yourselves, may have noticed a lot of energy, anxious energy perhaps, a lot of adrenaline, but some creative bursts as we join together to try to solve this problem. There's not enough PPE, people are trying to figure out how to get it. Not enough masks, people stand up sewing clubs to start sewing masks. And there is this outpouring of support for our heroes in long-term care, in healthcare, and the people that pick up our trash and the people who serve us in grocery stores. So there are heroes everywhere, and this heroic phase is very, very well known and well described when disasters happen. And it's not surprising that one hears about it because we're actually made for it, as you will see in just a moment. This heroic phase is usually followed by kind of a honeymoon phase in which there's a lot of cohesion. And this gets us up to sort of May or June. And now we are fully in, I would say most people, this disillusionment phase where we feel angry and frustrated and not without reason. But whether there is reason for it or not, what we want to do is find our way out of it so that we can move forward in a more positive state and solve some of the dilemmas that are facing us. We also observe throughout all of this that human beings are remarkably resilient. You hear a lot about resilience these days, and sometimes people talk about resilience as though it's some kind of superhuman quality, as though it is something that people are born with and just possess, and that some people are more resilient than others by nature. But what I want you to understand, if you understand nothing else today, is that resilience is your natural human endowment. We are all resilient. Some of us don't know it because we haven't faced much adversity, so we're not very practiced at it. People who have experienced more adversity have had to experience and have had to cultivate their own resilience. But we all have it. It's a human capacity that we can nurture to help us get through this. Resilience, I also want to be clear, does not mean you never get knocked down. It means you get back up. Resilience is not about just being tough. It is about being able to get back up when you're knocked down. There's no one that's been untouched by this. And so all of us have been handed a difficult but great opportunity to really nurture our resilience. Now, I said before that we're built for this, and this is what I mean by that. Now, not to worry, I'm not going to go into a big, heavy brain lecture, but this is important for you to understand, because I think this is what's going to give you a handle on being able to deal with these very difficult emotions that so many of us are experiencing now. Basically, here's a quick walkthrough on your brain. You see there, right here in the center, this part here called the amygdala. You've probably heard of the amygdala before. It's sometimes referred to as our fear center. It's one of the oldest parts of our brain. It's also one of the most primitive parts of our brain. The amygdala is what gets stimulated in the face of a threat. And when the amygdala is stimulated, it shuts everything else down. To give you a really simple example, you're driving down the road, somebody pulls out in front of you, it's your amygdala that recognizes the threat as they come out, gets you to slam on your brakes, gets your heart rate racing, and perhaps your language loosening up, shall we say. The amygdala shuts everything down except that immediate motor response, except that adrenaline, except that cortisol release. Why? Because we need that. We need that fight or flight response to be able to allow us to immediately respond to danger. Unfortunately, what's happening now, I think, is that our amygdalas are working in overdrive, and we need to start taking charge of ourselves. We need to start activating the other parts of the brain that I'm going to tell you about in just a moment, because truly we have primitive parts of our brain and we have higher functioning parts of our brain, and it's the latter that we want to start using more. Here's how you do it. To nurture your own resilience, you got to build up your reserves. This starts very simply with knowing yourself. Know what stresses you out and avoid it. If you find yourself screaming at your television every night, stop watching it. If you find that taking a walk de-stresses you, take more walks. Know what turns you on and know what turns you off. Know what stresses you, what de-stresses you. Recognize too that we all have limits, and don't push yourself beyond them. Push yourself up to them. We have to, but don't push yourself over them. This means that you got to take some time for yourself, and I mean literally take time for yourself. Those of you who use some kind of calendar device, put time for me in there. Make sure that you honor it as much as you do time for everybody else. Psychologists tell us that this is actually, as silly as it seems, one of the most important ways that we take control of ourselves when the world around us feels so out of control. Practice good self-care means good sleep, good nutrition, good hydration. I think you've probably heard many of those tips before. I'd like to add to that list of good self-care that you be kind to yourself, as well as being kind to others. And follow these tips for strengthening your brain. As I said, our fear, flight, collapse response is on overdrive. The amygdala is on overdrive. And we no longer need to be as afraid of this virus as we have been. In the beginning, we didn't know anything about it. Our actions, our decisions, the level of anxiety made perfect sense. But we know now what we didn't know 6 months ago. We know what works and we know what doesn't work. We also know that there is a lot right now in public discourse designed to keep us afraid, to keep us on high alert. I don't care where you are on the political spectrum, both ends of the political spectrum are ramping up the fear meter. Remove that stressor. If you are big into social media, stop that daily doom scroll. Give yourself 20 minutes a day, not 2 hours a day. Give yourself 5 minutes a day. But seriously, there is a lot in public discourse right now that is keeping our amygdalas so activated that the other parts of our brain are malfunctioning. You no doubt find yourself a little more distracted, forgetful, confused, irritable, hair trigger. That's all amygdala action. And we want to tame it down. There are 3 things you can do starting tomorrow, starting today if you like. Physical exercise is one of the best ways to tame the amygdala. 30 minutes a day if you can swing it, 15 minutes of aerobic exercise if you can't get in a 30-minute walk. This alters the cortisol levels and starts signaling to the amygdala, I got this, you can calm down now. Deep breathing exercises, easy to do, easy to learn. You sometimes hear this referred to as diaphragmatic breathing. It just means breathe into your belly. Let your belly expand when you take a nice deep inhale. Hold it for a moment and a nice slow exhale. Do that 3 times. You can reset your amygdala, reset the autonomic nervous system. And then finally, we also know that ways to chill out an amygdala are through mindfulness practice. Now, you hear a lot about mindfulness these days, and there are wonderful mindfulness training programs, but the kind of mindfulness I want you to employ doesn't mean that you have to go take a class. It means that whatever you do it in a mindful way. You can mindfully make a cup of coffee. You can mindfully brew a cup of tea. Pay attention to the here and now, what's in front of you, and you can practice it. Right now while I'm speaking, a little mindfulness exercise would be to look around the room, wherever you are, and just name to yourself 5 things. Now, this might seem silly to you, but when you do that, you are actually deactivating the amygdala, and you are saying, I got this. I think I'm going to use this higher part of my brain, this prefrontal cortex. I think I'm going to use this part of my brain, the anterior cingulate cortex. I think I'm going to go to my higher power brain. Okay? So exercise, breathe, live more mindfully. And if you have the ability to, go online and check out some mindfulness programs, check out some mindfulness apps, or just look around the room. Be aware of your body and space, be aware of what's around. The part of the brain that has been, I think, underactivated throughout all of this is a part of the brain, as I said, called the anterior cingulate cortex. You don't need to know that unless you like words and it's fun, but you can know it as the ACC. This is the emotional regulation center, okay? And if you have felt for 6 months stuck in that irritable, forgetful place, in this disillusionment of anger and anxiety, it is because you probably haven't been paying enough attention. Let me rephrase that. I don't want to be critical. It's not that you have done something wrong. It's that you may not know that you have a part of your brain that could be helping you with some of those negative feelings. That part of the brain, the emotional regulation center, is actually pretty easy to activate. One of the ways that we activate the emotional regulation center is to simply name what we're feeling. It's one of the reasons I start the exercise that way, or start the conversation that way. Just the act of naming how we feel, just the act of acknowledging our circumstances helps calm that overactive fear center that many, many forces are trying to keep activated. Interestingly, emotional regulation is also activated by practicing gratitudes. Lots of people have a gratitude practice. They keep a journal. At the end of the day, they write in it one thing for which they're grateful for that day, one person for whom they are grateful for having them in their life, and they tell that person, I appreciate you because. A lot of people also use mantras. Some people use prayer. Mantras include things like, this too shall pass. I don't know when this will be over, but I actually know that it will be. because all things come to pass. I can't control this, but I can control these things in my life. People use mantras of all kinds. Perhaps you have a favorite of yours. What you may not have known is that it's not silly to do it. It's actually a way of activating a part of our brain that gets turned off when we need to slam on our brakes, when there's a threat, when there's a fear, and we become hypervigilant, scanning the environment for more threats. We're not wired so that we sit there and think, should I put my brakes on or not? Is that guy trying to cut me off or not? We don't have time for that. So we're designed to respond immediately. But what we seem to have forgotten oftentimes is to turn that other part of the brain back on when we do need it. Finally, the part of your brain that you want to strengthen and that we're going to talk about as we go through the rest of this is our way out and our way forward, is to activate that part of your brain, the prefrontal cortex, that allows you to think and plan and solve problems. But we got to reboot it because it has been overwhelmed by what we have had to deal with in this collective trauma. It has been overwhelmed by this disaster because we've not just been coping with COVID. We have been coping with racial strife and racial injustice. We have been coping with climate change. We have been coping with hurricanes and wildfires and a particularly contentious political season. So there are a lot of reasons that we're feeling so distraught. And the good news is we can do something about it. So you got to reboot your prefrontal cortex. You got to activate and nurture other parts of your cortex, and you got to chill out that amygdala so that we can bring our best wisdom and judgment to the road ahead. How do you do it? One thing is you got to exercise it. I mean, literally exercise it. Make plans, think, solve problems. Practice flexibility. This is an interesting one. When you are discussing a variety of ideas with people, don't always make yours be the one that has to be chosen. Be flexible. In the world of good ideas, try out somebody else's good idea, because it turns out that letting other people have their way, when it is okay to let them have their way, and their way may not be as good as yours from your point of view, but if you can see that it's good enough, practicing flexibility actually wires your prefrontal cortex in a way that allows you to make better judgments, to think, solve more problems. And so the way we say this in neurology is neurons that fire together, wire together. So the good parts of your brain, so to speak, the wisdom, the judgment, the executive function, the higher levels, okay, need exercise. And we exercise them in these ways that I'm saying. What we're going to talk about as we move into the next section here is talking about strategies for self-care, caring for staff, caring for residents, solving this problem of isolation, which is the problem now that we need to bring our collective wisdom to, are not just going to be good for ourselves and for our loved ones and for staff working in long-term care. They're going to be good for our brains, because that's what our brains want to be doing: strategizing, thinking, solving, coming up with solutions. So that's how you build your reserves. You take good care of yourself. You remember what I said about the brain, chill that amygdala, exercise, meditate, pray, be kind, problem solve, strategize. Number 2, actively plan for the weeks ahead. I would encourage all of you to begin, if you haven't already, begin educating yourself about all of the changes that, or all of the information rather, that has come out in the last month. I'm referring to a report that was commissioned by Centers for Medicare and Medicaid Services, that you know as CMS. And that Nursing Home Commission report is on the Consumer Voice website. I want you to read it. I want you to know that even though it may seem at times like no one is paying attention to what's happening in long-term care, people are paying attention. They're not sure what to do about it, but they are paying attention. It's important that you know that. It's important that you See to what extent the problems your loved one is facing are reflected in that report. And if they're not reflected in that report, that you let somebody know, because that's how we build our knowledge base. Prepare yourself for small steps in the reopening. You will also find on the website the most recent CMS guidance on indoor visitation. As you probably know, following on actually this commission, I don't know that they're linked in the decision making, but I know that within days of the commission report coming out, we had new guidance from CMS about requiring long-term care facilities to create a plan for indoor visitation. That outdoor visitation, which many places are doing, was no longer going to be sufficient. And so most all facilities are scrambling to try to figure out how they can meet that mandate and provide for safety. Expect small steps. Expect that we're going to be incrementally improving the way we do things to solve this problem of isolation, which is huge. As you actively plan for visiting your loved one, start asking them and thinking about what are the comfort objects that you can bring? What are you going to be allowed to bring? What are the conditions under which you're going to be allowed to bring things in? Solve those in advance. Talk about those in advance. When I talk about comfort objects, that's going to be highly individualized. I don't have a list of what comforts, but you know what de-stresses or what comforts your loved one. When you go in for a face-to-face visit, you also want to be thinking in advance of what your stay in touch plan is going to be, because I don't imagine yet that indoor visitation is going to be as free as it used to be. Educate yourself about your state regulations as well as these reports. You can find it on your state website. Go to whatever state you're from, .gov. Look for state regulations on nursing homes. Find out what they're doing. Find out what conversations are being had. Your local long-term care ombudsman is a great source of information, as is Consumer Voice, and I've referenced them a couple of times. Know also, when you want to have a conversation with your nursing home, what the community transmission rates are for your particular community, because many states are couching their response to these regulations in terms of what their phased reopening is. They're not, air quotes, supposed to, in the sense that CMS has said, don't wait for that phased reopening, solve the indoor visitation problem now. But as you know, in communities with very high rates of transmission from the community, that is not going to happen quickly. And it's not going to happen in the way that you might like to see it. Try to adopt a headset when you go to the nursing homes that signals that you have a both and headset, that you are not interested in compromising safety in favor of quality of life. This isn't either we keep people safe from COVID or we let them do what they want or have a high quality of life. This is about having visitation in a way that is safe. This is about having touch in a way that is safe. This is a way about enhancing quality of life and keeping safe. This is about the rights of the individual and the rights of the community. This is about the needs of the individual and the needs of the community. And think of the homes that your loved ones live in as partners. Partners in re-examining this whole area of compassionate visits, the whole area of essential visitors. As you probably know, many states are looking at having family members designated as essential, because in this time of shutdown, essential workers were able to go in. I'm a consultant to some nursing homes. I haven't been allowed in since March. Do a lot of virtual consulting, but as a consultant, considered non-essential. So you want to start working now on what your state is willing to consider an essential visitor. Will it be one family designated as essential? What will it mean to be an essential visitor? Can we begin to look more closely at a reasonable definition of compassionate visits so that we're not, as we have been, in the place of waiting till time of death or near death, which is what it has been to date. Now, again, I am not critical, and I hope I don't appear critical of these protections that were put in to mitigate the risk of the virus. If you hear criticism or if you hear frustration, it is because it's now October. It's not last March. We know so much more. And I think one thing that has thwarted our progress is our tendency as a collective, to get into these either or things. Either we're going to have visitation or we're going to have safety. And it hasn't served us well. And so I really want to make this case for a both and way to approach things. The next thing I want you to do in these weeks, in this planning for the weeks ahead, is to get really clear with yourself, with your family, and with your loved one about what it is that really is troubling to you and your loved one about the current circumstances, whatever they are. For some, it's going to be the lack of privacy. Why does this staff person have to sit in here and make sure that I keep my distance? Okay, that's a frustration some express. Some don't mind the lack of privacy, but really don't like not being able to touch. And some don't like the inherent, what feels like an unfairness, right? When different homes seem to have different rules. We like justice, we like fairness, and there does seem to be some fundamental lack of fairness in some communities, certainly not in all. My appeal to you is to say, name your concern as concretely as possible, because that's the way we engage the higher parts of our brain and we get down to real problem solving. Now, when you go in, you know some of what you're going to hear. And I've taken some of these quotes from a recent report from Alterum, from a survey they did, simply asking nursing home residents, how's it going? And people said, I want to go home. I'm so lonesome. This is awful. I feel like a prisoner. Some people said, staff's working very hard, and I thank my CNA for taking good care of me. Another person said, the administration will not create an area that's safe for us to go out or assign staff. I miss visiting my friends and miss having group activities. And when you read the report, you will be moved, I've no doubt, by how many people report this feeling of lonesomeness, of feeling like they are in a prison. So much so that people are saying they'd rather die of COVID than to feel so lonely. And this is what I want to avoid. This isn't die of COVID or feel lonely. This is what requires our collective wisdom right now, is how to deal with the isolation, how to deal with the loneliness and keep safe from COVID. That's what we're going to have to do. But you can hear in that the pain, the anger, the blame, and that's what you're going to hear when you go in. If your loved one is living with dementia, it adds a whole new dimension. People living with dementia, particularly for people who have lost their words or don't use language, I should say, use words to communicate, have an increased sensitivity to the feeling tone of others, okay? And what I want you to remember when you go in to visit with people who may have dementia is that anxiety is super contagious, but so is calmness. So it's really incumbent on you to present with an air of calm, and to appreciate that their sense of time and how much time has passed is likely going to be different than yours. There may not be an appreciation that 6 months have lapsed since your last visit. And so that's not what you want to lead with. What you want to lead with is how happy you are to see them, period, full stop. How are they doing? Attune to their needs and be prepared to find that some may even be thriving. Most are not. I don't kid myself on that, but many are. And one reason they're thriving is that under COVID conditions, we've had to use this thing called cohorting, putting people at higher risk together and then assigning them the same staff. That's called consistent assignment. It's been a long-standing goal of person-centered culture change. So attune to what's going on for them and be prepared to hear what it is. What I think you're going to be bringing in is a lot of your own anger and sorrow and frustration and grief and bewilderment and guilt and anxiety. And I totally get it. You're also going to be bringing in your hope and love and compassion. But the way I ask you to bring them in is in a regulated way, with an activated part of your brain that allows you to enter to the visit with some evenness, some openness, some ability to listen, and some tuning in, because that is what is going to be needed, particularly by your loved ones living with dementia. You set the tone and set aside your assumptions. Listen to the story they have to tell. Acknowledge their tears as well as their laughter, their fears as well as their comfort. This is a time for listening. This is a time for creating areas that are calm and comfortable. And that's why I said before, start thinking about what can you bring in that you know is likely to have the person feel better, something you can leave behind so that that space that they call home, that room, feels more calm and comfortable. You will, of course, be asked to take them home. It will, of course, hurt and be hard to say you can't. But you need to be able to be honest with yourself, to know your limits, and to validate how much a person wants to go home and how sad you are that that can't be. This is what I mean by tuning in. Our connections at this time are so crucial. And so even though you might be feeling tired of Zoom and tired of telephone calls, tired of window visits, keep them up in between the times that you can visit face-to-face. I'm even recommending that we get old-fashioned and start having pen pals. It's one of the things we're doing at the university. Send postcards. It's so important that people, all of us who have been through this traumatic experience, know that we are not alone. When you visit, acknowledge staff, thank them for doing a good job, and assume everybody's good intentions, even if they have fallen short in the execution. We've got to regain our confidence if we're going to be successful. We've got to know that we are not powerless. And when I say we are not powerless over this virus, I'm saying we know how to contain it. Someday we'll have a vaccine, okay, good enough. But right now, wash your hands, don't touch your face, stay home if you're sick, and practice distanced socializing. I'm suddenly very mindful of the passage of time, and I'm seeing some questions in the Q&A box. So I'll tell you what I'm going to do. Rather than just talk really fast, I'm going to go through the slides and just highlight a couple of things. One of the things that's been lost, I think, is the attention on the individual as we've had to move into like community-based needs. So one of the things that you can control and that you can contribute is making sure that you show up for IDT care plan meetings, make sure those interdisciplinary care plan meetings happen, make sure they're individualized. And if your loved one doesn't have an all about me, which means everything about them as a person sheet filled in, ask for one, fill it in, and take it in when you visit, because it's really important that people have options in how their day-to-day life goes, even if there are some areas that they can't control. If there are decisions to be made within your family, make them with a person and not for them. Here's a resource you'll be able to connect to from the Dementia Action Alliance. For those who have loved ones in assisted living who have access to the internet, hook them up to the Dementia Action Alliance Resource Center for a lot of ways for them to stay engaged. We need to make meaning of this experience. We need to scan for signs of beauty and hope. We need to remember that we have to participate actively in shaping the future. There's never been such a moment as this. And so let me put a plug in there for voting. I want you to share your stories with anybody who will listen. That includes each other, that includes your family, that includes policymakers. think, if you will, about one positive lesson or discovery you have made about yourself through this. It's in the nature of our being for everything not to be totally negative, even when it feels that it is. And I suspect some of you may have learned something about yourself, and I'll just ask you to reflect on that for a moment. Nurturing resilience in ourselves and others is an active process. It isn't something that's going to happen passively. It's a matter of building our reserves, maintaining connections, regaining our confidence, and making meaning of our lives. Remember, we are all in this together. And I ask you to stay in touch with me. Here are some ways to do it. You can email me at the university, follow me on Twitter, check in on our website, or visit my own website. Thank you so much for the time spent together this afternoon. We have 10 minutes instead of the 20 I had hoped for. But Lori, I wonder if you could take us through the questions.
Yes, and thank you, Dr. Weary, for an excellent presentation and some wonderful tips and strategies that people can use to not only maintain their own sense of well-being, but to help their loved one as they are able to reconnect with them. We do have a number of questions that had come in. Just very quickly, could you tell folks what an IDT plan is?
So sorry. IDT stands for an interdisciplinary team planning meeting. Everybody who lives in long-term care is supposed to have one. It means anybody who's there, from housekeeping, speech therapy, occupational therapy, nurses, doctors, etc., are all the disciplines who care for somebody. And that's what an IDT, that's what an interdisciplinary team is.
Mm-hmm. Thank you. There were a couple of questions that fell into a similar theme, which was communicating with a loved one who has dementia, who doesn't understand either why you haven't been there to see them or why you can't come in to see them, and how to maintain connection with that person during this time, particularly, you know, if you are able to go in and aren't able to go give them a hug, for example. They may not understand that. Can you maybe address that a little bit or give them some tips?
Yeah, boy, I'll sure try. This is a hard one because it is so individualized. First of all, I would invite you to remember that depending on how long your loved one has been living with dementia, or what kind of dementia, how it affects their brain, remember that that sometimes you will visit once a week or even once a day, and the next time you come in, they will say, "Where have you been?" This is what I mean about the sense of time being somewhat distorted. So I'm not sure that that we can help people understand passage of time who have lost that part of their brain that helps us all keep track of time. So what I would probably focus on instead is not explaining or apologizing or trying to help them understand that you have been coming or haven't been, but instead to focus on what are some ways you can connect. In other words, would a daily phone call for 2 minutes help? Would a daily phone call for 5 minutes help? Would a Zoom call weekly help? Is there any way of, depending on how tech savvy you are and all of those kinds of things, is there any technology that could help? There are all kinds of devices for people to have. Maybe they can have them in their room to see daily pictures, right, of the family coming up. So there's a tech solution. The high touch solution that I prefer is actually the daily phone call. I don't know of a single parent in the world who doesn't really, really appreciate that. And a lot of times people say, I hate to call because I always feel so guilty. I feel so badly. And all he ever says is, take me home. Okay. So I know those calls are hard, but find the connection that works. If there's a favorite picture, if there's a story, if there's a nightly song, if there's anything that is in your shared past experience, a ritual perhaps that you did together before, try to find a way to introduce it into the home. The idea of helping people understand why something isn't happening is really kind of futile because none of us really understand, or we don't like it. I always wish I had like a really clear, concise answer on that one because it comes up a lot. But I think oftentimes we're trying to help ourselves feel better. And in that moment, the thing that we can best do is to be calm. I'll just say a really quick story. I know we're running out of time. I'll say a really quick story. My father-in-law died with Alzheimer's disease about, I don't know, 8 years ago or so. And my spouse and I used to visit once a year, okay? That was as often, he was on the other side of the country, as often as I could get out there. And whenever we would go, we would have a great time together. He really didn't know who I was. And each time when I left, he would say to me exactly that. I don't know who you are, but I always feel better when you come. And that made me feel so good. It made him feel so good. So I make sure that the time that I am there is as endorphin filled and as pleasure filled as possible. And I guess that would be another way that I would put it.
Sure, that's a lovely story. Just related to what you were saying, one of our colleagues had used to send daily recordings to her father, messages that the staff were able to play for him. And so it was a way to have that daily connection so that he would hear her voice and know that she was thinking about him and loved him. And so she'd send him messages. And that was always, that's one that just really touched me. One of the good ones I've heard throughout this time.
I like that one too, Lori. And I just see something in the box here from Cheryl talking about how some people with dementia can't actually process a Zoom, can't benefit from a Zoom call because they can't process. And that's exactly right about person-centered care. We don't know who's going to benefit from what intervention until we give it a try. Some can, some can't. So you try it, you see what works. And if it works, you keep doing it. If it doesn't work, you try something else. So thank you for that comment. Lori?
Sure. So there was a question about how family members in particular can stay positive when they're coming up against frustrations from some of the facilities who seem to not be as communicative as the families would like, or sharing strategies for or even policies for visits, or maybe aren't as responsive as the family members would like. And so, how in terms of working with the facilities, how does one stay positive and stay upbeat to kind of keep going and keep moving forward?
Yeah, I think the way that I do it is to keep looking for the small successes and finding the common ground. I think that I start, so here are my tips for the up close and personal. If you're dealing with a single facility, find the one person that you think gets it. It might be the director of nurses, might be the administrator, might be a CNA, might be a social worker, whomever, and find your common ground, okay? Find the thing that, that you can, in fact, agree on, but assume about all of them their good intentions. Assume about everybody that they're doing the best they can, even if it's not very good. It may be the best they can. We don't know their lives. We don't know what they're dealing with. I do know what nursing homes collectively have had to deal with throughout this whole COVID pandemic. And it's an extraordinarily stressful. So assume good intentions. When, however, good intentions are not enough, hold people accountable, but in really straightforward ways, not you don't care or not anything accusatory, but to say, this is what my father, mother, sister, brother, whomever needs. Say that you would like to be part of the solution. Use a both and approach. Look for any opportunity to be helpful. When, however, that is still insufficient, that you haven't identified that person and the up close and personal doesn't work, call your long-term care ombudsman. That's what they're there for, is to be a voice for the resident, to find out what the resident also wants, and to help you achieve that. And so talk with them. If that isn't really the issue, but the issue is really that you're sort of, you remain unhappy about conditions generally, get involved in advocacy. One of the best ways to build emotional reserves and to activate that higher part of your brain is to try to live a life of service and to try to be of help to others. So contact Consumer Voice. I'll put you to work doing advocacy. So when you don't get the response you want, try somebody else. Like, mom's not listening, try dad, try your other mom, try whomever, okay? That's not working, to have a conversation, finding that common ground, kick it up a notch. That isn't working, become an advocate.
Mhm. And I think that that is some excellent advice, and I think a good place to end for today, which gives folks some really good tangible strategies to use for moving forward. So I would really like to thank you, Dr. Weary, for your excellent presentation, your wonderful tips, very useful information, and you can see that from the comments that have been coming in, how much the participants have enjoyed the presentation and discussion today. And I'd also like to thank Brenda Gallant, the State Ombudsman from Maine, for partnering with us on this program today and helping us produce it so that we could bring it to all of you this afternoon. So again, you have seen Dr. Weary's information up there. We will be posting the recording of today's presentation along with the slides and the other resources that were mentioned today on the website. You can also get additional information about visitation on the Consumer Voice website. We have a new family visitation page. And we also are asking those of you who have been in to see your loved ones, we have a survey out for families who have been able to reconnect with their loved ones to take a very quick survey to let us know what you're seeing when you go back in. So that's on our website as well, and we'll link to that in the materials that we send out to you when we send the recording of the slides. So thank you all so much for joining us, and have a good rest of the afternoon. And Dr. Weary, thank you so much again.
You're welcome, and thank you, Lori, and thank you, Brenda.